Healing minds, psychedelic mushrooms versus Western medicine for mental health. In recent years, there has been an increasing interest in alternative treatments for mental health disorders, particularly the use of psychedelic substances. Among these, psychedelic mushrooms, also known as Psilocybin mushrooms, have gained significant attention for their potential therapeutic benefits. When comparing the effectiveness of psychedelic mushrooms and traditional Western medicine, there are several factors to consider. From their mechanisms of action to the results seen in clinical studies, this video explores the growing debate over whether psychedelic mushrooms are a viable alternative to conventional treatments for mental health conditions such as depression, anxiety, and PTSD. The rise of psychedelic mushrooms in mental health treatment. Psychedelic mushrooms contain the compound psilocybin, which has been shown to affect serotonin receptors in the brain, influencing mood, cognition, and perception. Psilocybin works by altering the brain's default mode network, DMN, a group of interconnected regions that is typically active when the brain is at rest or daydreaming. Research has suggested that psilocybin can reset the DMN, which is often overactive in people with depression and anxiety. For centuries, indigenous cultures have used psychedelic mushrooms in religious or shamanic ceremonies, often to promote healing and self-awareness. However, in recent decades, the scientific community has revisited these substances with renewed interest. Clinical studies have demonstrated that when used in a controlled setting, psilocybin can help individuals confront deep-seated emotional issues, alter negative thought patterns, and even provide lasting relief from symptoms of depression and anxiety. One of the most promising aspects of psilocybin is its ability to promote psychological breakthroughs during therapy sessions. Studies have shown that a single dose of psilocybin, when combined with guided therapy, can lead to significant improvements in mood and overall mental health. Research conducted by institutions such as Johns Hopkins University and Imperial College London has revealed that psilocybin-assisted therapy can be just as, if not more, effective than traditional treatments like antidepressants and cognitive behavioral therapy, CBT. Western medicine and mental health. Western medicine has long relied on pharmaceutical treatments to address mental health disorders. Medications like selective serotonin reuptake inhibitors, SRIs, benzodiazepines, and antipsychotics are commonly prescribed to manage conditions such as depression, anxiety, schizophrenia, and PTSD. While these drugs have been proven to alleviate symptoms for many patients, they often come with side effects, long-term dependency issues, and limited efficacy for some individuals. SRIs, for example, work by increasing the availability of serotonin in the brain, which can improve mood and reduce feelings of anxiety. However, it can take weeks or even months for patients to experience the full effects, and the drugs are not effective for everyone. Additionally, side effects such as weight gain, sexual dysfunction, and insomnia are common, which can deter patients from continuing treatment. Other medications, such as benzodiazepines, which are used to treat anxiety, can be highly addictive and come with a risk of overdose if not carefully monitored. Furthermore, while antidepressants and antipsychotics may help regulate mood and prevent relapses, they do not necessarily address the root causes of mental health disorders. They often mask symptoms without providing lasting solutions, and their efficacy can diminish over time. This has led many to search for alternative therapies that could offer more profound and lasting changes in mental well-being. How psychedelic mushrooms compare to traditional Western medicine. When comparing psychedelic mushrooms to Western medicine, the key difference lies in their approach to mental health. While Western medicine primarily focuses on symptom management and chemical intervention, psilocybin therapy aims to provide a deeper, more transformative experience that could lead to long-lasting healing. Several studies have pointed to the potential benefits of psilocybin for individuals with treatment-resistant conditions, including those who have not found relief from traditional medications. One significant advantage of psilocybin therapy is the potential for lasting improvements with fewer sessions. Research suggests that a single guided session with psilocybin can result in lasting changes in a person's mental state, with some individuals reporting improvements in mood and decreased anxiety for up to 6 months following treatment. This is in stark contrast to the long-term use of pharmaceutical drugs, which often require continuous prescriptions and come with the risk of diminishing returns over time. Moreover, psilocybin has shown promise in treating conditions that are difficult to address with traditional medications, such as PTSD and end-of-life anxiety in terminally ill patients. In a landmark study conducted by the Multidisciplinary Association for Psychedelic Studies, MAPS, psilocybin was shown to significantly reduce PTSD symptoms and improve emotional regulation in veterans and individuals with severe trauma. This is a stark contrast to the limitations of conventional treatments, which may not always address the complex psychological experiences of those suffering from trauma. Safety and accessibility. Despite the promising results, the use of psychedelic mushrooms is not without its risks. Psilocybin, like other psychedelics, can cause intense psychological experiences that may be overwhelming for some individuals. For people with a history of schizophrenia or other psychotic disorders, psychedelic substances can trigger hallucinations or exacerbate underlying conditions. As such, psilocybin should only be used under the supervision of a trained therapist in a controlled environment to minimize the risk of harm. On the other hand, Western medications are often prescribed and monitored by healthcare professionals, making them more accessible to individuals seeking treatment. However, their potential for side effects, addiction, and long-term dependency can be concerning. Despite the widespread use of pharmaceutical drugs for mental health, they are not always as effective as expected, particularly when dealing with complex or treatment-resistant conditions. The availability of psilocybin is also a challenge in many parts of the world, as it remains illegal in many countries. Despite its therapeutic potential, this has sparked debates over the need for regulatory changes to allow for more research and access to these substances for medical use. A complementary approach. In the ongoing debate between psychedelic mushrooms and Western medicine for mental health treatment, it's clear that both have their advantages and limitations. Traditional Western treatments like antidepressants and therapy are widely accessible and effective for many individuals, but they may not provide long-term solutions or address the underlying causes of mental health issues. Psychedelic mushrooms, while still in the early stages of clinical research, offer a unique approach to mental health treatment that could provide profound, lasting healing for individuals who have not found success with conventional therapies. Rather than viewing these approaches as mutually exclusive, it may be more productive to consider a complementary model. Psychedelic-assisted therapy could potentially be integrated with traditional medical practices to provide a holistic treatment plan that addresses both the chemical and emotional aspects of mental health. As research into the benefits of psychedelic mushrooms continues to evolve, the future of mental health treatment will likely involve a combination of both innovative and conventional therapies. In the meantime, individuals struggling with mental health disorders should continue to explore available treatments and consult with healthcare providers to determine the best course of action for their unique needs. With more research and acceptance, psychedelic mushrooms could play an important role in the future of mental health care, offering a path to healing that goes beyond symptom management. Thanks for watching. If you enjoyed this video, please like, subscribe, and hit the bell icon so you never miss an update. Drop a comment with your thoughts, and I'll see you in the next one.